Many women around the world don't have the ability to control their reproductive lives, and they can't access the services or products they need. Our founder set out to create a research organization where priorities would be determined by women's needs. Her aim was to produce rigorous data that could lead to changes in policies and services and make a real difference for women. Ibis has not lost sight of that vision. For over a decade, we've conducted rigorous research that puts women's priorities first. Ibis seeks to improve women's reproductive autonomy, choices, and health worldwide. Our core activity is clinical and social science research, and we focus on increasing access to safe abortion, expanding contraceptive access and choices, and integrating HIV prevention, treatment, and care with comprehensive sexual and reproductive health services. Ibis seeks out innovative strategies to improve women's reproductive health and choices, and we've come up with unique solutions that positively impact women's lives. We integrate clinical and social science data to inform changes in policy and the delivery of healthcare services. We also partner with organizations all over the world. These are the people who can make change for women in their communities. They can identify sustainable strategies that improve reproductive health care access. And we take on topics that few other groups are addressing, such as the reproductive health of women serving in the U.S. military. Policymakers continually use our research to push for changes that improve women's lives. Ibis's highly committed, skilled, and experienced staff produces rigorous research driven by women's priorities. That research doesn't just sit on a shelf. We partner with established advocates and healthcare providers to identify pressing research questions and disseminate our results. Our commitment to developing and sustaining strong partnerships in many different countries enables us to produce high-quality research that can be used to improve women's lives. We measure progress in our priority areas: increasing access to safe abortion, expanding contraceptive access and choices, and integrating HIV and comprehensive sexual and reproductive health services. We track the number of research projects completed, papers published in scientific journals, and media coverage of our work. We also document the number and type of partnerships we develop and where partners and policymakers use our research in their work. Finally, we're working to expand the impact of our data and monitor our social media reach. We have an internal system for tracking specific indicators throughout the year, and we tabulate, review, and assess our progress on an annual basis. Ibis has a fresh take on reproductive health issues, and our focus on under-researched and potentially controversial issues driven by women's priorities sets us apart from other research organizations. Our small size means we're not weighed down by bureaucracy and can quickly respond to pressing issues and concerns, and conduct research on topics that other organizations may overlook. Ibis has had many successes putting our research in the hands of stakeholders who use it to inform policies and practice. The Oral Contraceptives Over-the-Counter Working Group has raised awareness about the potential of an over-the-counter birth control pill in the U.S., which could increase contraceptive access, ultimately reducing unintended pregnancy. Our research has established that moving the regular birth control pill over the counter would be safe and feasible, and has helped generate support among major public health and medical associations. This work has been covered in news outlets like the New York Times and CNN, and used by policymakers to make legislation. Ibis's focus on under-researched issues is much needed in our field, but funding for work in these areas is limited. We tackle large and complex problems that require not only technology and service delivery innovation, but also changes in attitudes towards women and their rights. Abortion is increasingly politicized and polarizing, and the climate in the United States in particular has become more hostile. Few funders focus on reproductive health generally, and even fewer support work to advance reproductive rights. While this makes fundraising more challenging, it also reminds us that the work we do is absolutely crucial. Increased funding would allow us to continue the campaign to move an oral contraceptive pill over the counter in the U.S., increasing availability of this safe and effective birth control option. As any woman who's forgotten her pills on vacation or run out of them on a Sunday knows, the prescription requirement can be a big barrier to staying on the pill consistently. Additionally, we want to pilot and test new ways to improve abortion access and the quality of care, make the case to end bans on public funding for abortion, generate research that can help persuade governments and funders to offer women the full range of contraceptive methods, and improve the quality of sexual and reproductive health information and services for adolescent women. Ibis has deep research expertise and strong relationships with the reproductive health and justice organizations leading grassroots and policy campaigns. We'd like to partner with these groups to launch an annual survey of women across the U.S. to collect critical data to strengthen their work and make change in women's lives. Ibis would lead the design and implementation of the survey and work with our colleagues to identify key issues and gaps in the data. This would help us ensure we have better data and stronger advocacy, particularly for women who are often left out or overlooked by our healthcare system.